Hi, it's Emma from the Pelvic Studio, and today we're talking about overactive bladder, or OAB. The two main symptoms of OAB are a sudden and desperate urge to urinate that's difficult to defer, and frequent trips to the bathroom. These things may happen with or without bladder leakage. The urge may be triggered by certain scenarios, such as putting the key in the door or hearing the sound of running water. OAB is more common the older you get, in women who have given birth vaginally, people who are overweight, and people who have problems with constipation. It may be worse when you're tired or nervous or at certain times of the menstrual cycle. And it can impact on work productivity, mental health, and sleep quality. To understand more about OAB, let's talk about normal bladder habits. Urinating 4 to 6 times per day and once overnight is considered normal. This might be slightly more in older people. A normal void is about 300 to 500 mils of urine, and you should be able to hold for about 2 to 4 hours between weeks. As you drink throughout the day, fluid filters through your kidneys and into your bladder, so it slowly fills until it reaches a good volume, usually about 300 mils. And when it stretches to this amount, your bladder sends a message to your brain that it will need to empty soon. This is the first urge to urinate, and you should be able to delay going if it's not appropriate to empty it. You should only feel that really strong urge after you've deferred going and your bladder has filled even more. Your urge to go should be in proportion to the amount that your bladder is holding. So getting a really strong urge followed by a really small wee indicates that there's something not quite normal. Often we teach our bladder bad habits, like going just in case, which can worsen OAB symptoms. If you routinely go to the toilet before your bladder is full, your bladder's threshold for signalling that it's full reduces. This sets up a downward spiral as your bladder tells you it needs to go when there's less and less urine inside. If you experience OAB symptoms, it's first important to rule out any other cause for urgency and frequency, such as a urinary tract infection or diabetes. If you're cleared from those things, you might be asked to fill out a bladder diary to help work out exactly what's going on with your bladder. First-line treatment for OAB involves a bladder training program supervised by a specially trained physio. This might involve learning urge suppression techniques, such as pelvic floor muscle contractions. And they might also help you modify things that can contribute to the bladder, such as certain foods and drinks, constipation, or straining to open valves. For more information, see our videos on filling out a bladder diary and urge suppression techniques, or book an appointment with the pelvic health physio.